Your surgeon may recommend a craniotomy or craniectomy procedure to treat a number of different brain diseases, injuries, or conditions. Your skull is made of bone, hard enough to protect the brain. Just inside your skull, 3 layers of tissue called meninges surround your brain. The thick outermost layer is the dura mater. The middle tissue layer is the arachnoid mater, and the innermost layer is the pia mater. Between the arachnoid mater and the pia mater is a subarachnoid space which contains blood vessels and a clear fluid called cerebrospinal fluid. Blood vessels called bridging veins connect the surface of your brain with the dura mater. Other blood vessels, called cerebral arteries, bring blood to your brain. Inside your skull, normal brain function requires a delicate balance of pressure between the blood in your blood vessels, the cerebrospinal fluid that surrounds your brain, and your brain tissue. This is called normal intracranial pressure. Increased intracranial pressure may result from brain tumors, head injuries, problems with your blood vessels, or infections in your brain or spinal cord. These conditions put pressure on your brain and may cause it to swell or change shape inside your skull, which can lead to serious brain injury. Your doctor may recommend a craniotomy to remove abnormal brain tissue such as a brain tumor, a sample of tissue by biopsy, a blood clot called hematoma, excess cerebrospinal fluid, or pus from an infection called an abscess, and many more others. The most common reason for a craniotomy is to remove a brain tumor. To begin, your surgeon will make an incision in your scalp. 1 or more small holes will be made in your skull. Then your surgeon will connect the holes to create a circular piece of bone called a bone flap and remove it. Your surgeon will make another incision in the dura mater to expose your brain. Then the tumor will be removed. The incision in the dura mater will be closed with sutures. Your surgeon will reattach the bone flap with metal plates and screws that will remain in your skull for life. You may have a variation on a craniotomy called a craniectomy if your brain is very swollen or your skull is infected. Your surgeon may delay reattaching the bone flap until a later procedure to allow time for the swelling to go down. At the end of either craniotomy or craniectomy, your scalp incision will be closed with staples, and your head will be wrapped in bandages. If you had a craniectomy, you will have another procedure called a cranioplasty at a later date after the swelling goes down. At that time, your surgeon will reattach your bone flap with metal plates and screws. Then close the skin incision with staples.